People who are supposed to heal us sometimes hurt us, and in some cases can kill us.
Shockingly, medical errors are the third leading cause of death. That's according to a 2016 study by doctors at Johns Hopkins.
And tonight, Team 12's Nico Santos exposes deadly medical errors at the hands of your doctor.
A sponge left inside a patient after surgery. Scalpels and scissors forgotten. The wrong leg amputated. The right side of the skull opened. It was supposed to be the left. These patients survived their medical errors, but other mistakes can be deadly. A flesh-eating bacteria mistaken for the flu. When this case went to court, a woman won $22 million after she suffered permanent damage to her vocal cords.
Drugs that shouldn't have been prescribed, surgeons that were impaired during the course of surgery. How on earth do you die during a hernia surgery?
Medical errors claim a stunning 250,000 lives a year in the U.S. That's according to Johns Hopkins Medicine. On the CDC's list of leading causes of death, it would rank third after respiratory and heart diseases and cancer, and way above car crashes and homicide combined.
It's very different.
Deb Saeed Gay lost her son just before Christmas back in 2014. She says he was misdiagnosed by emergency room doctors.
Because he used to bring the season to life.
10-year-old Isaiah went into the ER with flu symptoms. He was treated and released, but less than an hour later, the boy collapsed while his father filled his prescription at a pharmacy. Isaiah, suffering irreversible brain damage, he later died.
Without him here, it's just... I don't feel Christmas anymore.
In a wrongful death lawsuit, the parents claimed the boy had other treatable diseases, but they were not diagnosed. Swedish medical center reps only commented they were surprised by the accusations.
You're always going to have that grief. You're always going to have that person missing, and you just have to learn to live without them.
There were 126 million hospital visits last year. That means only 0.002% of the visits resulted in death. Medical error, though sometimes catastrophic, is extremely rare. And sometimes more stressful than dealing with a mistake are the legal issues that follow if you don't have solid proof.
Difficult or almost impossible to prove whether or not a malpractice caused the death.
Lawsuits can cost upwards of $50,000.
Litigation is traumatic. To force somebody to go through that so an attorney can make some money is unfair to them.
Banner Health, the only healthcare organization to respond to our request, says patient safety is top priority. They highlighted a list of practices in place in the care environment, such as providing 2 sets of caregivers to patients in the ICU and using decision-making technology that provides notification if a choice of care isn't consistent with evidence-based practices. But errors still happen. So how do you prevent them from happening to you or a loved one? The advice may seem like common sense, but very few people follow it. First, ask questions, lots of them.
Who do you think does this as well as you do? Who else would you recommend that I have look at my situation?
Get a second opinion.
Find out if you have multiple options.
Ask the doctor how many times he or she has performed the procedure and find out if the doctor has had issues before. You can find some of their history on azmd.gov. If you're going into surgery, the final tip, make sure the body part being operated is clearly marked before you go under. Nico Santos, 12 News.
Now, I think it's really important to point out here, before you swear off seeing your doctor, the same research that Nico was talking about also shows that most medical mistakes, most of them, aren't because the doctors are bad medical professionals.
That's right. Most errors are because of systemic problems like poorly coordinated care, problems with insurance networks, and maybe not having backup plans.
Another piece of advice, tell your doctor that you're okay if he or she tells you, I don't know, and also be willing to get, as Nico mentioned, a second opinion.
Well, new tonight, one of the jurors from